Hello, I'm Dr. Keith Fuster. Prograf, the brand name, and Tacrolimus, the generic name, refers to the exact same medicine. Although Prograf may be easier to say and remember, many patients actually take the generic version, Tacrolimus. Your pill bottles will often say Tacrolimus. Other nicknames include Tac, Tacro, and FK. We encourage you to be familiar with these names as they may be used interchangeably by your transplant team. This medicine prevents rejection to help protect your transplanted organ. Most patients take Prograf twice a day, as close to 12 hours apart as possible. Taking your medicine at the exact same time every day can be hard, so your transplant team may give you a window of time that you can take your medicine at each scheduled time. Remember, it's important that you never miss doses of Prograf unless specifically instructed to by your transplant team. Prograf can be taken with or without food. Be consistent with how you take it. Your transplant team may have a preference on how you take your Prograf and will tell you how before you leave the hospital. Your transplant team uses blood work to customize a dose that's right for you. Many patients will have blood work a couple of times a week, in the mornings for the first few weeks after you leave the hospital. You should have your blood drawn about 12 hours after your evening dose of medicine. It's very important that on the mornings of blood work, always have your blood drawn first before you take your morning dose of Prograf. As soon as your blood is drawn, you can take your medicine. Always bring your medicine with you on days of blood work, so you can take your dose right after your blood's drawn. This will help prevent you from missing your morning dose of medicine. Your transplant team can help you come up with a time schedule that works well for you before you leave the hospital. As a reminder, your dose of Prograf may change frequently. Make sure you write down your new dose every time it changes. Do not rely on the instructions on the bottles, as these quickly get outdated. Prograf capsules cannot be cut in half. You should also never be opened unless your transplant team specifically instructs you to open them. Prograf is available in many different dose strengths. Pay close attention to the strengths you have at home to make sure you're taking the correct dose. Since your body will require a specific dose of medicine, it may be necessary to use multiple capsules and different dose strengths to come up with the dose you need. Pay close attention to the directions your transplant team gives you so you're taking the correct dose. Some patients may develop tremors, often in their hands, when they first start taking Prograf. This is usually not a sign of harm or damage to the body and usually gets better with time. Prograf can cause high blood sugars, high blood pressure, and high cholesterol. These will be monitored by your transplant team and can be treated if any of them develops. Prograf can also cause headaches for some patients. This usually gets better with time. Tell your transplant team if you have frequent or severe headaches.